When it comes to East Africa, Kenya tops the number of COVID-19 cases. More than 36,000 have tested positive and 648 deaths so far and counting. But there is a country to the west of us where the numbers of positive and dead are both low. Rwanda, where less than 5,000 have so far tested positive and the deaths only 23. Why is that? Well, our very own Jeff Koinange has just come back from Kigali and gives us a first-hand lesson on what Rwandans are doing, or maybe what we're not doing, to flatten the curve. We call it Lessons from Rwanda.
Very well. 6 months into the coronavirus pandemic, you would think some countries would have let their guard down by now. But not so in Rwanda.
Nous aimerions rappeler à tous les passagers et au personnel de l'aéroport international de Kigali.
This is what greets you as you land at Kigali's international airport, a robot assisting arriving passengers in the country's official languages of Kinyarwanda, English and French to wear a mask. Artificial intelligence, it seems, is firmly rooted in the heart of Africa during these COVID times. By the way, robots like this can also be found at some of the country's main health facilities, a visible reminder of the seriousness of the Rwandan government in dealing with the coronavirus pandemic. From the airport and hospitals to the streets of the capital, Kigali. Here, everywhere you look, it seems like everyone, yes, everyone, is strictly adhering to the COVID-19 guidelines without exception. From the pedestrians walking to and from work, masks are a must. And we're talking masks covering the nose, not down by the chin. You climb on board any bus and it's the same thing. Firstly, no cash is exchanged between individuals. It is all automated. Secondly, once inside the bus, all the seats are marked. The red ones with the X on them mean you cannot sit there. The green ones with the tick means you can. It's as simple as that. Rules are laid down, rules are followed. Dr. Daniel Ngamije is Rwanda's health minister. He has a wealth of experience in dealing with viruses and epidemics, having worked for several years for outfits like the World Health Organization or WHO. He says it all boils down to leadership.
Strong leadership in this business. The leader, high leaders were there, starting from His Excellency, our President, Paul Kagame. He knows everything about COVID. He's aware of what is happening. He receives data every day, and he assesses those data. Means he's aware, and he can watch everything. Second, multi-sectoral approach for containing the disease. This is not Ministry of Health business only. It's comprised a lot of sectors to be part of it. From the top level up to the community level, people are owning the fight against COVID-19. Another thing, it's the health system. You know, the pandemic came, we had like only 2 months to try to set something, to develop our preparedness and response plan, to increase our capacity of testing, to have teams trained, deployed for conducting tests, tracing, and having people in treatment centers. You can't have this package available in 1 or 2 months and ready to work. It means you should start with a strong health system. A resilient health system is key because we're not starting from crash. We're starting from what is existing today in our health system. We have labs, we have staff, we have procedures. So it's a key message. We should learn from today that we need to build our health system to face other challenging situations which will come definitely in some coming years to be ready to face this kind of disease.
Rwanda's coronavirus death numbers are remarkably low, despite the mass testing going on around the country. A quick tour of Kigali, and you can plainly see how rules and discipline come together. Motorcycle taxis, or border borders as they are known in most countries, are always a good litmus test of law and order anywhere. Here, every rider is masked and has a helmet. Every passenger too is masked and also has a helmet. No exceptions. And here's the best part. Every border obeys traffic rules without exception. I can't remember the last time I saw borders stopping at a traffic light. It is no doubt a sight for sore eyes. By the way, just in case you forget a rule or two, there are friendly volunteer youth teams spread across the capital and towns around the country to remind you. In Kigali, they are known as the Kigali Youth Volunteers, and they are visible everywhere with their luminous jackets and limited intrusion. Their presence alone is enough to remind you to wear your mask and keep your social distance. And just in case you don't feel like following the rules, listen to what Rwanda's Minister of Health has to say.
The enforcement. Security organs and youth volunteers, a lot of sensitization through leaders in churches and at the local level, local leaders, authorities are there really to enforce the measure. We believe in it and we work on it.
Are there heavy fines for people who, let's say, aren't wearing masks?
At the beginning, we did so that people can fear to be paying the fee. And of course, with a lot of communication awareness campaign, we did with different organs, civil society organizations, we worked with media. So we are just like getting this as a result of people who are progressively changing their attitude. And they can see also that when they comply with measures, it's for their interest. We can demonstrate that in some settings, in some districts where people did not comply with measures at one point, then we have community transmission in a place, like in one district, in West. The consequences were there, and people could now link the compliance to preventive measures and high incidence of the disease and other consequences going on, like lockdown, localized lockdown, with all consequences of it. People will remain at home, they will close their businesses, they are really losing. And when they start to comply, and then we can lift progressively the lockdown. So there is a clear relationship between complying with preventive measures and the incidence.
By the way, public health awareness isn't just about robots, masks, and social distancing.
Now, everywhere you look in Kigali, it is all the same. These water stations are literally everywhere. You don't have to be told to wash your hands. They do it automatically. They wait in line, social distancing. It's all over the place, whether you're uptown or downtown or in the equivalent of the CBD. It's obvious. Everyone follows the rules.
These water stations seem to be everywhere. Every commuter exiting and entering public transportation is required to wash their hands thoroughly, and they do so almost as though it were second nature to them.
In all your years as a medical doctor, did you ever think something like this would ever come about that would literally stop the planet? Did you ever think?
For sure, no. I think this is the first time. This is the first time that we have a disease putting everybody at home, paralyzing trade, international flights, everything. This is the first time I saw it for more than 26 years as a doctor.
Is it scary?
Yeah. And what will happen in the future, I don't know. We need to be ready to face these kind of challenges.
Anyone coming into Kigali for the first time would think they had stepped onto another planet. streets free of ugly, smelly garbage, no open sewers, neat, well-swept sidewalks strictly designated to pedestrians, traffic lights that actually work, and most of all, commuters who obey the traffic laws. It doesn't take a rocket scientist to tell you that all it takes is simple law and order. Rules are laid down, rules are followed.
Jeff Koinange, Citizen Television in Kigali.